Good day everyone, my name is Kenneth D. Velasquez, a student nurse from Davao Doctors College, and today I'm going to perform my return demonstration in assessing the eyes of the patients. So a comprehensive eye examination can also diagnose symptoms just like diabetes, high blood pressure, high cholesterol, tumors, cancer, autoimmune disorders, and of course, even thyroid disorders. And a comprehensive eye examination will also provide an accurate prescription for a glasses or even contact lenses. So the first thing that we need to do is that we need to review the client's previous medical records if available, because this will be verifying the need in performing this assessment. So as I have checked the medical records here, it shows that the patient has no any previous medical records in this hospital, and this will be his first assessments here. So after verifying the need to perform these assessments, I need to determine the scope of this assessment and also preparing the necessary equipment for this assessment. And completeness and organization of our equipment will ensure our efficiency as nurses. And the equipment that we'll be using will be the following: the pen light, the Snellen chart, the opaque card, the jot down notes and ballpen handy, magazine, and also these gloves, and of course alcohols. Okay, so after identifying the equipment that we'll be using in this assessment, we need to perform hand washing and of course use donned gloves if necessary. So right now we will be doing a hand washing, and after that we can now enter the patient's room. And now I am done performing my hand washing. So right now we are now ready to enter the patient's room. Hello sir, good morning. Masulod ka sir ha? Sige sir, salamat. Okay, so since I am now in the patient's room, the first thing that I need to do is that I need to greet the client politely and the client's companion if around. And also, I need to introduce myself to verify the client's identity and ask how the client would like to be called during this assessment. And also, this procedure will help us establishing rapport with the client, and verifying the client's identity ensures that care is being rendered to the correct clients, and also explaining the procedure to the clients and how he or she can participate during this assessment will be providing the clients the opportunity to clarify, ask, or raise any concern. And this procedure will help us explaining the procedure rather to the clients can reduce the client's anxiety and enhance cooperation. So, sir, good morning. My name is Kenneth D. Velasquez, a student nurse from Davao Doctors College. And pwede na ko matanong yung wristband, sir? Ibutang lang diri, sir. Salamat. Okay. So, can you tell me your full name, sir?
Miles Daisy Balios po.
How about your birth date, sir?
February 10, 2001.
Okay, sir. Thank you for that. So, karon sir, kay atong buhaton kay mag-assess ko sa imuhang eyes. Tapos, mag-use ta aning Snellen chart, and of course, tumanan nang nimo ko kung unsa akong kuan sa imuha ha karon, okay? So, before we proceed, sir, do you have any other questions so far?
Pila ni kami needs?
This assessment, sir, usually starts 15 and a maximum of 30. Okay. So, do you have any other questions so far, sir? Okay. So, also that I need to ensure the client's comfort, privacy, and confidentiality And assessment setting needs to be assured to be safe, secured, and free from distractions. And position the client in a comfortable sitting position because it will be providing for the client's privacy, protects the client's integrity, and enhances comfort. And this is also to ensure the dignity from the patient to the nurse. So, sir, so karon kay I just need to close the door and secure the curtain, sir. Okay? Okay lang. How about the temperature, sir? Okay lang? Natugnawan ka wala? Okay, adjust na
Ano
ako.
kay jacket ba?
Sige. Nice. Okay, sir. So, how about your sitting position, sir? Natay adjust. Okay lang. Wala naman kailangan concern, sir, no? Okay. So, the working phase. The first one is assessing the visual acuity. So, this is to check how well a person can see the details of the letter or symbol from a specific distance. And the first thing that I need to do is I need to check for use of any visual aids prior to starting the test. And if the client has lenses, glasses, make sure to check them because they will be wearing that one during the test. And make sure that the client distance 20 feet or 8 meters from the Snellen chart covered the eye being tested, and ask him or her to read each line until he or she cannot decipher the letters or their direction. So, sir, di ba nag-eyeglasses man ka? Okay. So, so you can use that one, sir. Okay, nakita mo gito ko, ganyan na okay, eyeglasses na yun. Sige. So, in this test, sir, kay, of course, naatay ganito na ingani, we will be using, or we will be testing your left eye first, then your right eye, and then your, both of your eyes. So, i-cover na to ni ingana. And also, sir, we'll be using this Snellen chart. Nakakita, first time, hindi mo nakakitaan ni? Oh, first time. So, naatay diri ang mga grades, sir, and each line, you have to read that one. And then, you just tell me, sir, kung asa nimo dili, asa na line ka na dili kayo na klaro, okay? So, shall we start, sir? Okay. And also, please take note to took 3 readings, right eye, left eye, and both eyes. Okay, sir. So, karon kay maudaay ni ang Snellen chart, makita nimo no? O, sige. So, karon mag-start tayo using your left eye covering your right eye. So, can you please cover that one, sir? Make sure lang, sir, na makakita lang kay left eye nimo ha. Sige. So, you can now start reading, sir, please.
EFPTOZ, LPED, PECFD, EDFCZP, FELOPZD, DEFPOTEC, and the rest of the magpaklaro pa rin.
Okay lang. So, that's actually okay, sir, kasi you have 20 over 20. You reached the level 8, which is normal, sir. Ay, mahang left eye is normal. So now, we'll be proceeding to your right eye, sir, covering your left eye with that opaque card. And you can now start reading, sir.
EFPTOZ, LPED, PECFD, EDPFZ, CZP, FELOPZD, DEFPOTEC.
Okay. So, how about this one, sir? Di na mo basa.
Mabasa man pero kana malibog lang ko sa letter sa sahay. Pero LEFODPCT.
See? Okay, thank you, sir, ha? So, imohang right eye, sir, has a normal vision, which is 20 over 20. So, karon, sir, kay, we'll be testing both of your eyes. You don't need to cover your eyes with this opaque card. So, pupunin ko na po ito, sir. So, can you please start reading again, sir, please?
EFPTOZ, LPED, PECFD, EDFCZP, FELOPZD, DEFPOTEC, LEFODPCT, FD, walang sir.
Oh, okay. Okay lang. It's okay. So, karon sir, kay naadi ay kay 20/20 for your both eyes. So, your both eyes, sir, under the visual acuity test, you have a normal vision, sir, okay? So, after that, record the readings of each eye and both eyes, and the basis in recording for this will be the smallest line from the line which the person cannot read one half or more of the letters. And this procedure is very essential because again, to check how well a person can see the details of a letter or symbol from a specific distance. So since the patient can read this Snellen chart, I need to assess the near vision acuity of the patient, and to assess the near vision acuity by providing adequate lighting, and ask the clients to read from a magazine or a newspaper and hold at 36 centimeter or 14 inches from the patient to that magazine. Okay. So karon sir, kay na ako ipabasa sa imong wish is this one, and this will be 16 inches from you, 14 rather, I'm sorry. And kanilang sir, ingan lang ka, pwede niyo mo pakibasa, kanilang dire.
This beautiful example of Einstein's moral strength and courage, even in the face of the undeserved death, reminds us Jesus' exhortation, not be afraid of anything or anybody.
Okay, thank you for that, sir. Okay. Sir Miles was able to read from a newsprint, but then again, if a patient has difficulty reading a newsprint, unless due to aging, this will be a sign for a abnormal findings. And also, if the client is unable to see even the top line of the Snellen chart, which is the 20/200, perform selected vision test, just like the light perception, followed by the hand movement test and the counting fingers. Okay, sir, so let us start the light perception test. So now, sir, we'll be using this pen light. Is it okay, sir, if I ask, is this your first time seeing a pen light? Is this our first time, sir, using a pen light to you? So, ano, sir, pinaman ka times din mo nagamit na? 2 times. So, may I ask also, sir, kinsa ang nag-assess sa imo ani?
Daan.
Okay.
Gusto ko di ba kanso?
I see. Okay. So, the light perception test, sir, kay ingnan lang ko nimo kung whether the light is turned on and off in a specific position, sir. Okay? So, napay pangutana, sir. Wala. Sige, mag-start na ta. So, kani, sir, on or off?
On. Off. Sa baba na makikita. On. Off. On. Off. On. Off. Sa taas na pagkakita. On. Off.
Okay. So, salamat kayo, sir, ha? So, the vision is recorded as LP rather, but if the client will be unable to perceive lights, hand movement test will be assessed. So, this will be the procedure for the hand movements. Hold your hands 30 centimeter or 1 feet away from the client's face and move it slowly back and forth, stopping it periodically, and ask the client to tell you when your hand stops moving. Okay, sir, so magtindog lang ko, sir, ha? 1 feet away from you. So, what I need you to do, sir, is that you need to tell me whether my hands are stopped moving or what direction am I pointing to you, sir, okay? So, before proceeding this one, sir, do you have any other questions so far?
Dugay pa niyo.
For this assessment, sir, usually, again, we do have a 15 as minimum and 30 as maximum, sir, okay? Okay, so let us start, sir, or do you have any other questions? Okay, so let us start. So, please tell me, sir, if my hands are moving.
Nag-move siya.
Sige. Please tell me, sir, ha, kung mag-stop na ito.
Stop. Stop na siya. Stop.
Okay. So, sir, now, sir, please, what direction, please tell me what direction I'm pointing to.
Sa ceiling, sa taas. Sa baba.
Okay, thank you for that, sir. Okay, and if the client knows when your hand stops moving, record the vision as H over M, 1 feet. But if the client is unable to identify the hand movements, then counting fingers will be assessed. So, counting fingers procedure, okay? So, the first thing that you need to do is that hold up some of your fingers 30 centimeter or 1 feet from the client's face and ask the client to count your fingers. Okay. So, sir, bali, so karon na assessment, sir, the counting fingers. What I need to do is that count the fingers that I am portraying, sir, okay? So, how much is this, sir? How many is this?
5, 3,
Kani, sir?
2,
It's 2. Okay,
2 rock.
thank you, sir. Okay. And if the clients can do so, notes on the vision record, and it will be recorded C over F, 1 feet. So, nevertheless, my patient has normal visual acuity with a 20 over 20 and is able to read from a newsprint and inform the clients that the visual acuity assessment is done by also like doing a hand washing and documenting the findings of this assessment. So before that, I need to perform hand washing again, sir. Now, sir, I need to test your visual fields, okay? So I need to face the patient directly at 60 to 90 centimeter or 2 to 3 feet away. And I need to instruct the patient to look directly into into my eyes with both eyes. This is because this assessment or procedure will determine the function of retina and neuronal visual pathways to the brain, and second, or the optic cranial nerve. So again, place hands about 2 feet apart, lateral to the patient's ear, and slowly move your wiggling finger of both hands along the imaginary bound father over the patient's head until the patient identifies them. And also, we need to ask the client to tell you when the moving object is first spotted. And of course, repeated the action in the upper and lower temporal quadrants. Okay, sir, so karon let us start. What I want you to do, sir, is that I want you to tell me kung makita nimo ako ang kamot sa ako ang buhaton. So we will be using both of your eyes and of course your right eye itself and left eye itself, okay? So before we start, so do you have any other questions? Okay, so if this will be the case, sir, let us start, okay? So tanaw lang sa ako ang eyes, sir. And from this, inan ko, sir, kung makita na nimo, ha? Kani.
Kita.
How about this, sir?
Kita.
Kani, sir.
Kita.
Kani, sir. Okay, so now, I have proven that my patient has normal visual field, but if a defect is detected, slowly move the wiggling fingers from the defective area of the field toward the better vision, and repeated this at several levels until the border of the defect has been defined. And also, test another eye for an accompanying defect. So, I just want to show you this one. So, sir, are you ready now? I-test lang na ko imong left eye first, okay, imong right eye, okay? So, ina na ko, sir, kung makita, okay? So, please focus in my eye, sir, in my eye level. Sige.
Kita.
Sige. Kani, sir, how about this one?
Kita.
Kani.
Makita.
Okay. So, thank you for that, sir, by the way. And when looking straight ahead, clients can see objects in the periphery. And of course, the result will be temporally Peripheral objects can be seen at the right angles, 90 degrees to the central points of the vision. And the upward field of my patient is normal, which is 50 degrees because the orbital ridge is in the way, and the downward field vision of my patient is normal, which is 70 degrees because the cheekbone is in the way. And also the nasal field of vision is of my patient is normal, which is 50 degrees away from the central points of the vision because the nose is in the way. And of course, visual inspection of the eyes. So let's proceed to this one. I need to visually inspect his eyes for alignments and symmetry. And of course, I need to inspect the eyebrows for hair distribution and alignment and skin quality and movement. And also, I need to ask the client to raise and lower the eyebrows. So first, we need to have the gloves first. Okay, sir. So, karon kay check lang nako imong eyes, imong eyelashes, imong eyebrows, okay? So, pwede na ko gunitan imong answer. Okay. So, pwede niyo mapakitaas imong eyebrows, sir, please? Pwede niyo pakibaba, pwede pakitaas ulit, then pakibaba. Okay, thank you for that, sir. So I have observed normal findings in patient miles. Hair distribution for eyebrows are evenly distributed. Skin was intact. Eyebrows were symmetrically aligned and equal movements. So, but then again, if your patient has loss of hair in the eyebrows, scaling and flakiness of the skin, and equal alignments and movement of the eyebrows, then the patient has abnormal findings. So the next one will be inspect the eyelashes for evenness of the distribution and direction of the curl. So sir, i-check lang na kayo mga eyelashes. Nagitan ako sir ha. Okay, thank you sir. So patient Miles again has a normal finding. His eyelashes are equally distributed and curled slightly outward. But then again, if your patient turned inward its eyelashes, then it will be an abnormal finding. Okay. So the next one will be inspect the eyelids for surface characteristics. It's like example, skin quality and texture and position in relation to the cornea, ability to blink and frequency of blinking, and of course inspect the lower eyelids while the client's eyes are closed. Okay, sir. So now we will be start. I will be checking your eye and i-ask the sir na i-close ibuhang eye, sir, o nga i-inspect na ko, okay? So from this, I will be using this cotton o ano lang, sir, tanaw lang sa ako, Close lang ang eyes. Okay. Check lang na ko usab dire. Okay. So, karon sir, pwede niyo may i-close imong eyes para sa ako. I-check lang ako ang... Okay. So, salamat sir ha. Also, inspect the area over the lacrimal glands and the lacrimal sac for swelling. Okay, sir. So, i-check lang ako ning diri mo na part. Okay. Ingnan ko sir akong sakit. Sakit sir, pag anaon. So far, wala man siya swelling, which is good. Okay, thank you, sir, again. And after that, ask the patient to look up, depress the lower lid of the patient with one's thumbs. Afterwards, to assess the sclera and bulbar conjunctivae. Okay, so karon sir kay, pwede ka mag-look up. Look up lang, sir. Eyes lang. I-check lang na ko ang sclera and bulbar conjunctivae. Okay. So, normal man siya, sir. Okay, next is that everted the eyelid to assess the palpebral conjunctiva. Okay. And also, carefully inspect the iris and the pupil of the patient and inspect each cornea and lens for opacities, clarity, and texture. And with this, I need to shine a pen light from the side toward the eye or shine a pen light at an oblique angle to the eye and move the light slowly across the corneal surface of the patient. And also, I need to ask the client to look straight ahead while doing so. So, sir, so karon kay we'll be using another pen light of I will be checking your eyes again. And also, I need you to please look forward to me and please sit properly, sir, if you may. Okay, thank you for that. So, while preparing, sir, do you have any other questions? Okay. So, mag-start na ko, sir, ha? Start ko dire. Please look at me, sir. Start lang ko dire. Nung ko i-check. Okay. Okay. So, okay, sir. Salamat, sir, ha? So, brown ang imong cornea, sir. And the lens opacities was normal. And the skin intact and no discharge and no discoloration. And the lids were closed symmetrically. And approximately 15 to 20 involuntary blinks per minute. And bilateral blinking. And when lids are open, no visible sclera above the corneas and upper and lower borders of cornea are slightly covered. But then again, if the patient has redness, swelling, flaking, crusting, flakes, discharge, nodules, lesions, lids closed asymmetrically, incompletely or painfully, rapid monocular absent or infrequent blinking, ptosis, ectropion or entropion, rim of sclera visible between lids and iris. This will be the abnormal finding. And also, assessing direct and consensual pupillary reaction to the lights, and assess each pupil's direct and consensual reaction to light. And of course, after this, darken the room partially and ask the client to look into the distance and shine a light obliquely into each pupil in turn using a pen light and approaching from the side. And of course, lastly, look for like a direct and consensual reaction. Okay, so during this procedure, we'll be using again a pen light and masilawan jud ka, sir, ha, pero tiis-tiis lang kay kadiyot raman ni. And also, sir, I need to turn off the lights, okay lang? And okay pa ba kasi mong position, sir? Do you have any other questions? So can I turn off the light now? Okay, so I will now turn off the light, sir, okay? Okay, sir. Salamat kayo sa imong kooperasyon, ha, okay? So, since this is your second time, sir, unsay man imong na-feel?
Wala, okay lang man.
Okay. Okay, so far, sir, you have a normal findings, man. So, you have nothing to worry about, sir, okay? So, this patient has normal findings, which will be illuminated pupil constricts, which is a direct response, and also non-illuminated pupil constricts, which is a consensual response. And also for this patient, his response rather is brisk. And if neither of the pupil constricts and unequal responses and response is sluggish, then the patient has, and also if this patient has absent responses, then he will be like considered like abnormal findings. And the next one will be assessing the accommodation for this patient. So, of course, we need to assess each pupil's reaction and accommodation. And this procedure will help us to detect the strabismus of the patients. And the first thing that we need to do is that we need to hold an object, a pen light or a pencil will do, about 10 centimeter or 4 inches from the bridge of the client's nose, and ask the clients to look first at the top of the object and then at a distant object, for example like the far wall behind the pen light or the pen, and instructed the patient to alternate the gaze from the near to the far object and observe the pupil responses after that. And of course, ask the client to look at the near object and then move the pen light to or pencil toward the client's nose. Okay, sir. So, i-start na ta ha. So, we will be using this pen but dili na to sigahan imuhang mata, sir, okay? So, first, look at here, then look there at the wall. Okay, let's start. So, this is 10 centimeter away from you. And please look at this one, sir. And also look at the wall. And I will slowly bring it forward. And please look at the wall, sir. Look here. Please look at the wall again and then look here. Okay. Sige, sir. Salamat kaayo, sir, ha? Okay, sir. So, for your result, sir, as you can remember kanina, when you look here, when you look at a near object, I have observed that your pupil constricts, which is a sign of normality. Constricts, sir, ng gamay. Your pupil ng gamay siya. But when you look at the far object, your pupil, sir, is like ningdako siya or nagdilate. But when I start to like forward this one, sir, in your nose, in the top of your nose, I have observed, sir, that na nag-converge imong eyes, which is a sign also of a normality. And of course, sir, before we proceed with the next procedure, do you have any other questions? Okay. So the next step will be, I need to perform the Hirschberg test in the patients. And so of course, I need to assess the ocular alignments arising from the extraocular muscles. And from this, I need to, from about of 2 feet directly in front of the patients, I need to shine a light onto the patient's eyes, and I also need to ask the patients to look at the pen light and inspect the reflections in the corneas of the patients and look for direct and consensual reaction. Okay. Okay, sir. So, karon kay magamit sa... Okay lang ka, sir? Okay. So, karon, sir, magamit ta og pen light usab og ikuan ako sa imuhang mata og what I need you to do, sir, is that please focus on my eyes. Okay, so before we start, do you have any other questions? Okay, this is 2 feet away from you, sir, so please look at my eyes and then I will just reflect it. Okay. Okay, so I want you to be informed, sir, that you have a normal in accordance with the Hirschberg test, sir, okay? And the normal findings for this is that light falls symmetrically within both pupils of the patients. And also, after this, I need to perform the cardinal fields of the gaze test or the extraocular muscle test. I need to assess the extraocular movements, looking for like normal conjugates or movements of the eyes in each direction, or any like deviation from normal nystagmus like lead lag and convergence. So from this procedure will help us to determine like the eye alignments and coordination. So in this, I need to stood to 2 to 3 feet in front of the patients, and of course ask the patient to follow my finger or a pencil while making a wide H in the air. So also look for a jerky movements of the nystagmus like on the lateral gaze and on the upward gaze. And of course, like watch for a rim of sclera between the upper lid and iris as the eyes move up and down. Okay, sir. So, karon na test, sir. What I need you to do is that you only need to follow this pen light, and we don't need to turn it on, sir. Okay, so you have nothing to worry about. So, before doing this, sir, do you have any other questions?
None so far.
Okay, so if this was the case, sir, let's start. Just follow this pen light, sir. Okay, and please make sure that your head is properly
straightened.
Yes, sir. Thank you for that. So let's start. Please look at this, sir. Let's start here. And then I just need to verify something here. I just need to check it. Okay. Okay, sir. Salamat, sir. So now we need to proceed with the last procedure, which is testing for the convergence. Now, I need to ask the patient to look at my finger, and as my finger moves towards the bridge of the nose of the patient, and also check the eye convergence after that. And this procedure will help us to determine the function of the third oculomotor cranial nerves. And okay, sir, so let us start, sir, ha. Na i-check lang usab nato ang imuhang convergence sa eye, which is nahimo nato ganiha, but to verify again, sir. Okay, so before doing this, sir, do you have any other questions?
So far.
Okay, so if this will be the case, sir, let us start. Please focus on my finger lang, and I will slowly move it to the top of your nose. And so nag-converge man imuhang eye, sir, which is a sign of normalities. Okay, pupils converge when near object is moved forward to the nose, which is like a sign of normalities. So now we need to proceed with the summary and closing phase. And we need to summarize the information obtained during the working phase and discuss the findings to the clients, and discuss to the clients like the possible plans to resolve the health concern if present, and also like assess for like the client's understanding of the plan and the need for further teaching, and provided the clients the opportunity to clarify, ask, raise any concern, and of course we need to thank the clients, and we need to end the interview politely and perform hand washing. Okay, sir. So, salamat kayo sa imong kooperasyon, ha. So, based diri sa ako ang findings at the very first step, which is the visual acuity rather. When you look at that Snellen chart, sir, imuhang both eyes normal. Imuhang right eye there is normal, which is 20/20, both eyes 20/20, and the left eye will be 20/20 also. And also, sir, the second procedure, which is the visual field, you have a normal, and temporally, sir, you have 90 degrees. The upward field, sir, you have 50 degrees. The downward field, sir, you have 70 degrees. And the nasal field of yours, sir, is 50 degrees. Okay. And also, sir, the third procedure, which is the visual inspection. Imuhang kilay, sir, kay ang hair distribution is normal. And your eyebrows, sir, is symmetrically aligned. And also, sir, it shows here that your skin distribution is intact also. And also, pagbaba og taas sa kilay, sir, you have a equal movement for that. And also, sir, your eyelashes were equally distributed in both eyes, and also it was curled and slightly outward. And the lacrimal area nimo, sir, kay no swelling, og pag-touch na ko, sir, wala man po siya sakit. As you have aforementioned a while ago, you have skin intact, no discharges, or meaning of the skin intact, meaning you have no discharges, no discoloration, and your lids was closed symmetrically, and approximately 15 to 20 involuntary blinks per minute na observe na ako kaganiha, sir. And you have bilateral blinking. And when your lids was open, sir, no visible sclera above corneas, and upper and lower borders of the cornea are slightly covered, which is signs of normalities. And of course, sir, your iris or your pupil size was equal in shape and light brown and no opacity. Of course, sir, the fourth one will be assessing direct and consensual pupillary reaction to light. So, your illuminated pupil constricture, which is the direct response, and also the non-illuminated pupil constrict, which is the consensual response. So, itong pag-anak na ko sa imuha, sir, kay nag-direct diri, o in the meantime, nag-direct po diri, which is the consensual response. Okay? And also, sir, the fifth procedure, which will be assessing the accommodation. Itong pagtanaw ni mo sa duol na pen light, sir, o sa layo na wall, mga naka-remember ka ato. So, when you look at the near object, sir, your pupil again constrict, which kanang nanggamay siya. When you look at the far object, nang dako imuhang pupils, or which is a sign of normalities. And when I have here, sir, it shows you that your pupil converge when your object is moved toward the nose. Means, sir, kanang pag-ana na ko dire kay nag-converge imo ang two pupils. Okay? So, the sixth procedure, sir, which is performing the Hirschberg test, katong pag siga nako mata na tanawan nako, sir, na ang light, sir, kay na fall symmetrically within both of your pupils, which is also sign of normalities. And of course, sir, the seventh procedure, which is performing the cardinal field of the gaze test, which is the extraocular muscle test. You have a normal findings for that. And also, sir, lastly, testing for the convergence, which is to converge. Pupil converge when your object is moved toward the nose. As I have said earlier, sir, pag ana na ko sa imo, nag-converge imo ang eyes, which is a sign of normalities. Pero, ang akong advice lang, sir, na dili ka dapat magpalabig, like exposed sa computers, like that, cell phones, kay maka-affect gud na sa imong eyes, sir, okay? So, are you planning to have a check-up, sir? When are you planning, rather?
Maybe next year or
Next year.
next month. I don't know. But wala man ko na pa-check-up. So.
Sige. And also, sir, I just want you to be reminded that please, like, sleep jud. Do not sleep deprive, sir, okay? Dapat mag-sleep jud ka 8 hours a day. Unya kanang nice imohang sleeping positions kay maka also affect gud na sa eyes. And also, sir, ang radiation talaga sa phone and sa computer, sir, please do like avoid that one, sir, okay? And also, sir, I have seen earlier that you are wearing glasses. May I ask, sir, when is the time that you are using that glasses?
It's almost a year.
Like, you are using that glasses, sir, when you are just reading, right?
No, I always wear it pag ano man gud yung ano ko yung glasses, ano yan. Para siyang
Reading?
pag
No.
hindi. Doubt mo gud kung mata jud. So, ako ang magong glasses is magano siya ba pag init kay wear siya sunglasses, so na-protect siya sa akong mata. So pag I mean ako lagi sunglasses pero pag ano murag sige tawag ano basta mo lahi iyang color black siya.
See, I understand.
Transparent.
Okay, so thank you for that
O
answer.
dapat siya anti-rat.
I see. Thank you for that answer, sir, okay? So what I advise, sir, is that please keep using that eyeglasses so that it will also help you to maintain the normalities of your eyes. So again, sir, before we end this discussion or this interview, do you have any other questions so far? Okay, so thank you very much again for your cooperation. So from this, we need to document the findings in the client record using the printed or electronic forms or checklist, just like this, supplemented by the narrative checklist, supplemented by the narrative methods also when appropriate.